Over the last decade, there has been a tremendous effort to begin integrating social determinants of health and social risk factors of patients into their electronic health records. And the goal here is to treat patients' clinical and social risks within the health system. I think there's so much promise here, but at the same time, there may be unforeseen consequences or risks in this process. I'm Jennifer M. Silva. I go by Jen. I am a sociologist and I am an assistant professor at the O'Neill School of Public and Environmental Affairs at Indiana University. My research this year at Russell Sage is exciting, innovative, and very challenging. It began with in-depth interviews with low-income women, Black, white, and Hispanic in Northeast Pennsylvania. And I talked to women for a few years about their health, their healthcare challenges, how they thought about illness, medications, vaccines, and also the clinical encounter. And from there, I was able to pair up with an epidemiologist, Anne-Marie Hirsch, and she was able to pull these women's electronic health records with their consent. And so what we're able to do is compare accounts of women's health from both the perspective of the women themselves through an in-depth narrative, but also through the electronic health record and free text notes of clinicians. And what this allows us to do is kind of understand the miscommunication or confusion that might be intervening between women and health. We know that clinicians, like everyone else, may have unconscious biases towards poor people or people of color. And so one of the things that might happen is if a patient comes into a clinical encounter and shares information about their background, such as they're poor or maybe they're an unmarried mother, we might see in the electronic health record some discrimination or bias against this patient. And so what Anne-Marie and I hope to do is both explore the promise of integrating social risks into clinical care, but at the same time, we want to make sure that integrating social determinants of health into electronic health records doesn't then become used as ammunition against patients. This year at Russell Sage Foundation has been magical. As a professor, you're always reading, you're writing, you're teaching, you're doing service work. You never really get to just pause and think. And so this year, I feel like I've had this freedom to explore new ideas, to be creative, to just immerse myself in research and ideas in a way that just isn't possible with the pace of everyday academic life. I've become really good friends with many of the other fellows. We exchange work, we help each other, we support each other, we hang out together, and of course we have lunch together as it brings us all together. And we talk about work, but we also just talk about life and careers and enjoy the time together.